My name is Tori,
My name's Naomi.
and today we'll be presenting Hildegard Peplau for the theory of interpersonal relations. So we're just going to take a little look behind Hildegard Peplau when she was growing up. She was born in 1909 in Reading, Pennsylvania, and at 9 years old in 1918, she experienced the flu epidemic, where she saw how the illness affected everybody, and how death was affecting families and the mental health aspect of it. So, when we look at her education, she decided to become a nurse because she wanted to help change the face of nursing, but also it was one of the only careers available at the time for women. And in 1931, she graduated from Pennsylvania School of Nursing. And in 1943, she actually worked at the Bennington College in Vermont, and they recommended her to work as the school nurse there full time. And from there, she earned her bachelor's degree in interpersonal psychology. And in 1943 to 1945, she served as a nurse in the Army Corps. And while she was there, she was stationed at the 312th Field Station in England. She had the opportunity to work with leading figures in American and British psychiatry. And Peplau and these figures worked to reshape the mental health system in the United States through the passage of the National Health Act of 1946. And in 1947, she earned her master's and doctoral degrees from Teachers College and Columbia University. And in 1950, she became certified in psychoanalysis at the William Alanson White Institution in New York City. Also in the 1950s, she developed and taught the first class for graduate psychiatric nursing students at Teachers College. In the 1950s and 1960s, she supervised workshops. She was the advisor for the World Health Organization. She was a visiting professor at many different countries, such as Africa, Latin America, Belgium, and throughout the United States. She was a consultant for the United States Surgeon General, the Air Force, and the National Institution of Mental Health. Also in the 1950s and 1960s, she supervised summer workshops for nurses throughout the United States, mostly in state psychiatric hospitals. And in these seminars, she taught concepts of interviewing techniques and individual, family, and group therapy. And then in the 1954 to 1974, she served as a professor emeritus at Rutgers University, where she created the first graduate level program. And in 1975 to 1976, she served as a visiting professor at the University of Leuven in Belgium, where she helped establish the first graduate program in Europe. And now when we're going to her career achievements, she had many career achievements. She was the only nurse who served on the ANA as the executive director and the president. She served on the board of International Council for Nurses and the New Jersey State Association for 2 terms. She wrote many works. She was a prolific writer. Her most famous work was the Interpersonal Relations in Nursing, a conceptual frame of reference for psychodynamic nursing. Sorry. And other works include Interpersonal Theory and Nursing Practice, selected works of Hildegard E. Peplau, Basic Principles of Patient Counseling, extracts from 2 clinical nursing workshops in psychiatric hospitals. Her original book from 1952 has been translated into, I think it was either 6 or 9 languages. She was awarded 11 honorary doctoral degrees from Alfred, Duke, Indiana, Ohio State, Rutgers, and the University of Ulster in Ireland. So she was very influential. And then some more career achievements. She was the only nurse named 50 Great Americans by Marquise Who's Who in the Library of Congress. She was elected Fellow of the American Academy of Nurse in Sigma Theta Tau, which is the National Nursing Honor Society. In 1996, the American Academy of Nursing honored Peplau as a living legend. And she received the, sorry if I pronounce it wrong, but the Christine Raymond Prize in 1997 at the ICN Quadrennial Congress. And this prize is only given out every 4 years for outstanding national and international contributions to nursing and healthcare. And it is the highest nursing honor to be received. And in 1998, the ANA inducted her into the Hall of Fame, and she sadly passed in 1999.
So her theory is the theory of interpersonal relations. It was based off the nurse-patient relationship and how to establish a successful regimen. The theory focuses on three stages. They're all necessary for nursing attainment. They're orientation, working, and termination. So Peplau's theory focuses on the importance of greeting the patient with proper manner and respect. The establishment of relationship is built to diminish the initial stranger sense between the nurse and the patient. Getting rid of this sense can allow for a more profound relation. So for the working phase, the nurse's role is to gather as much information as possible to help the patient in every way they can. In order to develop a successful plan of care, there needs to be focused intervention specific to that patient. So the patients begin to accept their fate and realize their dependence on the nurse. This is why the initial establishment of the relationship is fundamental and cannot be deferred. So once discharged, it is the nurse's responsibility to educate the patient on how to manage their own care within their limits. Things like what kind of diet the patient should be consuming, what are the side effects of certain medications, or when it is appropriate to notify the provider of abnormalities. So the development of the theory is contributed to Peplau's clinical studies with psychiatric patients. Her background influenced her to find a universal solution of which could help not only the patient but the nurse as well. Harry Stack Sullivan was a psychoanalyst that created the psychiatry behind interpersonal relationships. His work inspired Peplau to seek a better way to treat patients without compromising their health and boundaries. So Percival Simmons, Abraham Maslow, and Neil Miller were also credited to the development of the theory. So Peplau's theory today has been used by many scholarly psychiatric doctors as a foundation for their studies. Cheryl Forcock is a distinguished university professor that has specialized in mental health research. She used Peplau's unique point of view on the orientation phase as a base to understand the relation between client and nurse and how that impacts the recovery of the patient. Forcock developed her own model, the relationship form, to study how, why, and when the patient assimilates their own role in the orientation and working phases. Forcock finds that the orientation phase is the primary factor to the recovery of the patient and is also the determinant of whether or not it is successful. In most recent times, Forcock has taken the time to conduct research on the factors that influence the patient from transitioning to the working phase from orientation. Peplau's theory of interpersonal relations has been the foundation for several clinical studies involving mental health. More specifically, her theory is used as a different approach to diagnose and establish the different phases of depression. Researchers have focused primarily on the orientation phase and evaluate the patient to dictate whether the nurse-client relationship is affecting the client in a negatively way. They have found that the negative impact often results in slower healing and depression. So Hildegard was recognized as one of the most influential modern scholars in nursing research. She was awarded many acknowledgments for her work in this country. Her work has also been translated into 6 languages to be used for people all around the world. She had an expert advisory position with the World Health Organization. The AAN, or the American Academy of Nursing, awarded her the highest honor and was from there on called the Living Legend. She was the only living nurse to be recognized that year in 1998 with the ANA Hall of Fame. So, Peplau's theory has had an immense positive impact in nursing. She did her best to keep the patient as the top priority in her research. Because of this, Peplau introduced a new method for nursing care, one where the nurse could help the patient and vice versa. So she involves things like in-depth interviews consisting of specific questions to find out how the nurse can develop treatment. The assessment and implementation allow the nurse to perform to the best of her abilities to assist in decreasing the patient's symptoms and keep him or her steady. In the end, patient teaching provides intellectual knowledge for the patient so that he or she can implement necessary tasks to their daily lives to keep healthy stability.
In Pepper's research, she was highly inspired by Hildegard Peplau and his interpersonal theory, which stated the purpose of behavior is for the patient to have his or her needs met through interpersonal interactions, as well as decrease or avoid anxiety. And it was very important for Peplau to develop that relationship with her patients and to get that patient-centered care. She really wanted to understand the mental health aspect of it and how the patient's mental health affected us, the nurses, and as well as nurses affecting a patient's mental health. She was also highly inspired by Percival Simmons, and he was responsible for the scientific study of personality. Abraham Maslow, and he did the theory of human functioning, and Neil Elgar Miller, who studied personality and psychotherapy. And here are our references. And thank you so much.
Thank you.
Bye bye.